Welcome to Lesson 1, which will focus on alcohol use disorder. And the verse guiding this lesson is from Titus chapter 2, verse 11 and 12. For the grace of God has appeared, bringing salvation for all people, training us to renounce ungodliness and worldly passions, and to live self-controlled, upright, and godly lives in the present age. Individuals in recovery from alcohol use disorder often utilize the 12 steps, where step 2 is coming to believe that a power greater than ourselves could restore us to sanity, which speaks to the saving power of God, who is, for most individuals, our higher power. And the medical term for alcohol is, of course, ethanol, which is derived from fermentation of various carbohydrate sources. And it is thought that the process of uh, consuming alcohol began nearly 9,000 years ago. While alcohol may not be available in some countries, it is often readily available in most countries. It is often distilled and measured in milliliters of alcohol per 100 milliliters of the beverage. That will give you the strength. And um, most beer has about a 6% um, alcohol concentration, which is equivalent to 6 milliliters of ethanol per 100 milliliters. And while alcohol is readily available, it can be harmful. And there are some risk factors for the incidence of disability. And this is conceptualized in disability adjusted life years, or DALYs. And alcohol is thought to cause 7% of all DALYs in the population aged 10 to 24 years old. Again, this is worldwide. And it is thought to cause 4% of deaths worldwide. There's a higher rate of fatal injuries in younger populations. And there is a greater disease burden in males, in individuals of lower socioeconomic areas, and it does produce a significant economic burden to the population because of the costs associated. Now, alcohol is highly addictive, and when consumed over a moderate amount, can cause serious disease and disability. Alcohol use can be both a warning sign as well as a risk factor for suicide. Individuals under the influence of alcohol often make suicidal statements or gestures and even attempts. Some individuals will be admitted to a psychiatric facility under a Baker Act while under the influence of alcohol, intoxicated. And sadly, the next day, when sobering up, many are discharged without adequate treatment for the alcohol use disorder, which is important. Alcohol is a CNS depressant and can lead to depression. Individuals under the influence of alcohol are likely to be more impulsive and reckless and act without thinking and may act upon feelings of hopelessness or um, other situational stressors. Alcohol use disorder brings a myriad of problems, including reduced school and work performance. It also can cause accidents and injuries. There is family disharmony and even violence or abuse. Additional problems include suicide, homicide, crime. It is also teratogenic. So, women are encouraged to abstain from alcohol during pregnancy. Exposure to alcohol during pregnancy causes a risk for fetal alcohol syndrome. Alcohol is neurotoxic, and there are some problems that develop, such as Wernicke's encephalopathy, early onset dementia, and these are from the alcohol damage to the neurons. Alcohol depletes the myelin that coats the neurons due to often vitamin B deficiencies. Alcohol can cause this brain damage then in later years. Alcohol use also contributes to risk for cancers, various cancers of the mouth, throat, GI tract, as well as the liver. Besides cancer of the liver, cirrhosis of the liver is another very serious and often fatal disease process caused by alcohol. Alcohol is rapidly absorbed through the GI system and distributed throughout the body, impacting the brain through the cardiovascular system. It causes disinhibition, but also impaired memory and decision making and incoordination. Other side effects can be nausea, vomiting, hangover, the experience of blackouts, and acute gastritis. Severe alcohol poisoning can even cause the experience of stupor, coma, and death from respiratory depression. Here are the effects of alcohol um, according to the blood alcohol concentration or blood alcohol level. It's often reported in a range um, of grams per 100 milliliters, as well as the number of standard drinks that will typically produce that level of blood alcohol concentration. So, for example, the ingestion of 1 to 3 drinks per hour can cause a blood alcohol concentration of zero point zero 0.01 to zero point zero 0.05. And at this level, one might observe an individual seeming pretty normal, and the individual might say that they feel relaxed. You may notice that the individual is a little disinhibited. They may be talkative and feel more confident. Higher levels, after 3 to 5 drinks, can cause a blood alcohol concentration of 0.05 to zero point zero 0.08. At this level, an individual is starting to have some signs of intoxication and the experience of euphoria. You might notice increased self confidence, talkativeness, disinhibition, loss of concentration, and impaired coordination. At this level, you can see that it would be dangerous to operate a motor vehicle. And 0.09 to 0.15 blood alcohol levels can occur from consuming 5 to 9 standard drinks. An individual might appear excited at this state, but you will also notice slurred speech and unsteady balance, emotional instability, and the loss of judgment. Higher levels become dangerous. 9 to 16 drinks can cause a blood alcohol concentration of 0.16 to 0.25, and the individual would experience confusion, disorientation, nausea, vomiting, memory impairment, a staggering gait, apathy, and incoordination. And above 0.25 or more than 16 standard drinks, and an individual can experience coma and even death. Alcohol is metabolized by the liver and broken down into alcohol dehydrogenase and aldehyde dehydrogenase. And it breaks down at a rate of about 7 to 10 grams per hour. Blood alcohol concentration increases from 10 to 20 milligrams per 100 milliliters for every 10 grams of alcohol. An individual who consumes alcohol before the age of 14 has a very high risk for developing later an alcohol use disorder. And again, alcohol exposure to the fetus is highly teratogenic and can cause fetal alcohol syndrome. Fetal alcohol syndrome is a neurodevelopmental disorder that occurs from the teratogenic effects of alcohol. And around 1% of all births in Western countries can have some deficits from this problem. The full syndrome can occur with binge use or with repeated use. And the facial features that are prominent with fetal alcohol syndrome can occur especially from exposure early on around week 3. Risk factors for alcohol misuse in children and adolescents include anxiety disorders or a shy temperament, depression, ADHD, conduct disorder, a history of abuse or poverty, parental modeling of drinking, family conflict, poor parenting or inadequate supervision, as well as peer pressure or peer influence. Some additional factors that can influence the development of an alcohol use disorder include genetic predisposition, and this has been shown through the adoption, twin studies, as well as family studies. Individuals with ADHD, conduct disorder, or anxiety disorders also have a high incidence of comorbid alcohol use disorders. Families that have members that have um, harmful or alcohol misuse are more likely to contribute to the development of an alcohol use disorder, as well as overly permissive parenting or poor supervision. And social factors can influence the development of an alcohol use disorder. So, what they say about peer pressure is absolutely true. And the influence can occur from peers or friends or living in a certain culture. Some cultures utilize or drink alcohol more than others. And if alcohol is easily available, then that can contribute to the development of alcohol misuse or alcohol use disorder because it is an addictive substance. Being an indigenous minority also has been shown to be a risk factor for alcohol use disorder. Children and adolescents should be screened or assessed for alcohol misuse. It's important first to build rapport with the individual, and that is done through maintaining a non-judgmental approach and the use of strategies such as motivational interviewing. It is important to let the child or teen know about the scope and limits of confidentiality, and this will often help improve their trust and disclosure. Um, as well, screening all adolescents, such as using the craft. And if it is positive, then additional screenings may be needed or more detailed assessment. The CRAFT questionnaire is the most common or popular screening tool used for children and adolescents, and it asks about the past 12 months and certainly starts off with assessing the number of days that the individual drank more than a few sips of beer, wine, or any drink that contained alcohol. As well, it asks about the use of any marijuana or even synthetic marijuana or vaping THC. It also asks about the use of anything else to get high, such as other illegal drugs, prescription, or even over the counter medicines, such as those um, cold remedies, and asks about sniffing or huffing. So the craft begins with questioning those three areas for the number of days in a year that the child or adolescent utilized those things. Now, if they had 0 for all of those, then you would just ask number 4, which is, have you ever ridden in a car driven by someone, including yourself, who was high or had been using drugs? And that is the C for craft. Now, if they had a 1 in any of the boxes asking about the number of days drinking alcohol, using marijuana, or any other substances, then you're going to go on with the rest of the craft, which the R is for relax. Did you ever use drugs or alcohol to relax or feel better about yourself or fit in? A, alone. Did you ever use alcohol or drugs when you were by yourself or alone? The first F is for forget. Did you ever forget things you did when using alcohol or drugs? Screening for blackout. The second F is, do your friends or family ever tell you that you should cut down on the amount of drinking or drug use? And then the T is for trouble. Have you ever gotten into trouble using drugs or alcohol? Now, in addition, the audit is the alcohol use disorder identification test. And that is another screening tool more specific to alcohol. And the results indicate the level of risk or harm. And so less than 8 would be low risk drinking, 8 to 15 would be problem use, 16 to 19 harmful use, and then over 19 high risk or dependence. And the CAGE questionnaire. The four questions. Did you ever feel the need to cut down on drug or alcohol use? Have you ever been annoyed by somebody criticizing your alcohol or drug use? Have you ever felt guilty about your alcohol or drug use? And have you ever used alcohol first thing in the morning to feel better or get going? And here's an example of a two-question screen. In the past year, have you sometimes been under the influence of alcohol in situations where you could have caused an accident or gotten hurt? And have there often been times when you had a lot more to drink than you intended to have? If either of these are yes, the individual has an 8-time risk for the development of alcohol use disorder. When talking with youth about alcohol, some important questions include the frequency of drinking. Is it daily, weekly, or irregular? The amount and type is also important. Ask them to describe the last drinking occasion and ask about the number of each type of drink that they have consumed. Patterns are important, and so finding out about their usual use pattern can be helpful to identify what level of intervention is needed. So ask them to tell you about their recent drinking. How much have they been drinking lately? And to tell about a time when they were drinking heavily. Now, context is important. Identifying the underlying issue for the alcohol use disorder, perhaps a comorbid disorder. So, identifying triggers for use, whether boredom or anxiety, do they drink alone or with friends or both? Why do they drink? What do they get out of it? And how are they paying for it and getting it? How many times have they been intoxicated? Have they ever had blackouts? Have they ever had a hangover? How often? Have they ever been in a car accident related to drinking? Now, risk taking is important. Have they had unprotected or high risk sex after drinking or driven a car while intoxicated? And then impairment. How has alcohol caused impairment in their life? And ask about relationships at work, home, or school, as well as course failure and um, loss of employment. Some lab values that can be helpful in identifying potential risk of harmful alcohol use include the blood alcohol content or blood alcohol levels, and as well the liver enzymes, aspartate aminotransferase, alanine aminotransferase, and the gamma glutamyl transferase. Now, the mean corpuscular volume is another measure that can identify a potential risk for alcohol use problem. Alcohol intoxication is a common problem for adolescents. When severe, it is considered alcohol poisoning. Many will result in a trip to the emergency room. And so, first, it's important to exclude any other causes for the symptoms that they are presenting. And those symptoms typically will include slurred speech and coordination, unsteady gait, nystagmus, attention or memory impairment, stupor, or coma. So, the diagnosis of alcohol use disorder does include continued use of alcohol in spite of it causing impairment of functioning, risks to themselves or others, social or interpersonal problems, as well as physical health problems. And as well, the development of tolerance, drinking larger and larger amounts, the experience of withdrawal symptoms, cravings for alcohol, the desire or unsuccessful efforts to reduce alcohol use, and as well spending a lot of time in activities to obtain, consume, or recover from the effects of alcohol. Alcohol withdrawal can be another diagnosis when an individual has developed tolerance and continued regular use. When attempting to stop drinking, they can experience symptoms such as autonomic hyperactivity, sweating, increased heart rate, increased blood pressure, as well hand tremors, insomnia, nausea, vomiting, and even transient visual, tactile, or auditory hallucinations, um, sometimes referred to as delirium tremens, which often will also consist of psychomotor agitation, severe anxiety, and even grand mal seizures. Alcohol intoxication can be fatal. Severe alcohol intoxication or alcohol poisoning requires immediate attention. The individual can develop hypothermia, arrhythmias, compromised heart function, or respiratory depression. They can have problems due to a decreased gag reflex and acute respiratory obstruction due to vomiting and decreased arousal. And so, aggressive respiratory and cardiovascular supportive care is often needed. And many young individuals with alcohol poisoning may even be admitted to the intensive care unit. Often, children or teens can present with traumatic injuries related to the intoxication, but it's important to identify if there were any other ingestions of any other substances involved as well. When an individual presents with an alcohol poisoning event, it's important to be sure to follow up with intervention and treatment and even consider a Marchman Act if the individual is not open to accepting or seeking treatment voluntarily. Alcohol withdrawal can be fatal, and so it's important to screen for the potential or risk for withdrawal and then assess for the experience of withdrawal using a screening process such as the CIWA, the Clinical Indicator of Withdrawal Assessment. And when you have a patient who is experiencing some alcohol withdrawal, they need reassurance and encouragement without criticism. It's important to provide adequate hydration, nutrition, and especially thiamine and multivitamins. And in severe cases, benzodiazepines are needed to reduce the risk of seizures. Severe agitation or hallucinations from alcohol withdrawal may need an antipsychotic such as Haldol. Adolescents seeking treatment for alcohol use disorder have often been mandated to do so by parents, the school, or the court system. So it may be a challenge to build rapport, but also critical. It's important to help the individual to gain insight into the risks of alcohol use on their lives. SBIRT is a great process. We'll have another lesson in this module focusing on that because it's important to motivate the individual for change, for accepting the change process in these cases, and often using motivational interviewing. Now, after treatment, some at-home monitoring may be required, such as breathalyzers or even urine testing. It's important when working individually with adolescents to see what is needed, abstinence versus harm reduction. Abstinence is usually needed when there has been a dependency because just having one drink often reawakens those cravings, and so that is often the approach utilized with the 12-step process. Um, though harm reduction may be helpful in some young adults in having parameters such as never having more than a second drink in a social occasion or actually any occasion. So it's important to identify for that individual what is best related to their belief system and their use patterns. And so it helps to consider the stages of change that an individual will often experience in the recovery process. And that can include first pre-contemplation, where they're just not really even thinking about it yet, and towards contemplation, preparation, action, maintenance, or relapse. A number of different types of treatments are available. Certainly, if there is a dependency going on, then a detox is often needed initially. And then some psychosocial treatments that obviously include the brief intervention process, such as using the SBIRT and other interventions. And opportunistic intervention is a gathering of friends and family to try to confront the problems that the use is causing for the individual in order to help them to have some insight and accept treatment. And as well, contingency management systems and self help organizations such as AA. And medication assisted treatment is very much helpful. There are some pharmacologic um, formulations available. Disfulrum or antabuse has been available for quite some time and will cause the individual to become very ill when drinking. Of course, because of the risk for that cardiovascular, reaction or hypertensive crisis, it's not used often in adolescence. And when using antabuse, though, it's important to make sure that the individual is not exposed to any alcohol, even topical substances such as skin preparations or even mouthwash. So, two additional pharmacologic treatments that are available for adolescents or young adults include naltrexone and acamprosate or Camprol. It is often best practice to combine both medication and psychosocial treatments together for the best outcomes, and using other tools as well, such as breathalyzers, can and drug screens or urine screens can help as well. Some evidence-based psychosocial treatments include motivational enhancement therapy, brief intervention, internet and cellular phone-based interventions or apps, family therapy, multi-system therapy, contingency management therapy, cognitive behavioral therapy, self-help groups such as Alcoholics Anonymous, Alateen, or Celebrate Recovery, and a combination of therapies as well. Contingency management therapy involves the utilization of some type of incentive and positive reinforcement. And so it involves having a formal agreement and a schedule for the rewards and some type of monitoring, such as the use of breathalyzers. And so you can include monetary rewards for each negative test and other approaches as well. And here we have some prescribing information for medication-assisted treatment. Medication-assisted treatment is often underutilized in children or adolescents as well as young adults. It is important to consider adding this to the treatment plan, um, especially the first 6 months, just to help to ensure success and prevent relapse. So, antabuse can start at 125 milligrams a day and titrate up to 500 a day. It is often important to have accountability partner to make sure that the individual is taking the medication. It is a pill that needs to be taken every day. And again, though, can have some risks because of reactions to any alcohol exposure in the environment. Naltrexone or Revia is also helpful at preventing relapse by decreasing cravings, but also decreasing the intoxication response to alcohol. And usually dose would be starting at 25 milligrams and the usual dose is 50. And it's taken once a day. Again, the accountability a partner is helpful there to monitor that the individual is taking the medication. It is available in a long-acting injectable as well. And this drug, however, uh, is metabolized through the liver, and so monitoring liver function tests is important. Campril, acamprosate, is available in oral tablets, but the dose requires 2 tablets 3 times a day. 2 tablets that are 333 milligrams 3 times a day. Now, I don't know why they settled on that dosage, 666, because certainly I've had quite a number of individuals over the years a little hesitant about using the medication because of that. However, evidence shows that it does improve abstinence, though there are some side effects such as nausea, insomnia, and diarrhea. It is less effective if it is not taken 3 times a day, and I have found most individuals have difficulty being adherent to taking it 3 times a day. Though the few that I have that have been meticulous about the regimen have found it very, very useful. Other medicines to help with alcohol use disorder include baclofen, SSRIs, and Topamax. Topamax, there is some evidence. It's not FDA approved for alcohol use disorder, but there is some evidence of its ability to decrease cravings and prevent relapse. Drug and alcohol prevention programs are very important, and many are brought into the schools in various educational programs. And there are other ways at preventing teenage alcohol use, and one of those are by regulating the minimum drinking age. And it has increased over the years. In most states in the country, it is 21. And we have drinking and driving laws and severe penalties, um, advertising or um, showing images, graphic images of um, accidents caused by alcohol can be a public service promotion, but also are required for many states in order to obtain a driver's license. There's a drug and alcohol use course that one must take, and it does include these types of images. So, prevention programs ensure that the individual has knowledge about the harms of use and looks at attitudes and perceptions about alcohol use and helps the individuals in developing decision making, assertiveness, and as well coping skills to deal with stress, anxiety, and other concerns. So it's important to prevent alcohol misuse through increasing the awareness of the influence of alcohol in our communities.